Now, for the glomerular mechanism of chronic kidney disease, you need to know that what generally when you speak about a glomerular chronic kidney disease, it is going to be divided into two. Is it clear? It can be a primary glomerular chronic kidney disease, or it can be a secondary glomerular chronic kidney disease. So when you have glomerular disease, it's divided into two. You have primary and you have secondary glomerular diseases. Secondary glomerular disease is coming from other pathways, as we have seen in acute kidney injury, where we have a acute glomerulonephritis. Is it clear? Now, we are going to, and this, they are mostly coming in a pathway of antibody mediated or immune complex mediated. I've already explained in the acute kidney injury. But now, for the primary glomerular disorders, you need to know that what these secondary glomerular disorders are going to affect the kidney. We said that it can either be antibody mediated, or it can be immune complex mediated, it can be directly antigen mediated, like in the case of viral causes like hepatitis B and hepatitis C. But now you need to know that what these secondary mechanisms, they are going to affect the kidney via the glomerulus via the primary mechanisms. Is it clear? And there are three major ways that is going to affect the glomerulus. Now you need to know to understand now the histology of the nephron. Now we need to know that what this was actually the glomerulus of the nephron. Is it clear? Now we are going to increase the diagram in order to visualize more aspect of this. Is it clear? Okay, so when increasing the magnification in order to visualize the histology, we see that here we are going to have the capillaries. Is it clear? So here we are going to have, here inside you have the capillaries. So these first cells here are the endothelial cells of the capillaries. Endothelial cells. Is it clear? So you first have the endothelial cells of the capillaries. That's the first point. Now, after the endothelial cells, we have now this other one. We have the membrane. Is it clear? We have first the endothelial cells, then we have the membrane, and then the last one, which is down, which is in contact. Here you are going to have the cells which are in contact with because you're going to have the tubular cells here. Is it clear? So these are the tubular cells down here. Is it clear? And this is the filtrate. Is it clear? The tubular cells, and this is the filtrate. Now these are the endothelial. This is the membrane, which is the second part, and down here we are going to have the podocytes. Is it clear? And then these are the cells which are going to be located. Now we need to know that what endothelial cells can be considered also as the mesangial cells. Is it clear? The endothelial cells and the mesangial cells are going to be considered because they are located both inside and also outward. So these two other cells that are filling the spaces in between the nephron, the cells that are filling the spaces in between nephron, are actually called the mesangial cells. Is it clear? And also the endothelial cells fill the spaces inward in the capillary. So that's why endothelial cells and the mesangial cells are going to be approximately considered the same. Is it clear? Now you can have primary injury to the nephron via the way of the endothelium or the mesangium. Is it clear? If you have injury to the nephron via those cells, it is going to be called a mesangio capillary glomerulonephritis. Is it clear? It's going to be called mesangiocapillary glomerulonephritis. Now, the second one is that you can have an inflammation. Is it clear? A primary mechanism via which you can have an inflammation only of the basement membrane. If you have just inflammation of the basement membrane, it's going to be called a membranous is going to be called a membranous glomerulonephritis. The next one is if you have inflammation only at the level of the podocyte, is going to be called the minimal change disease. Minimal change disease. Is it clear? And now all these are going to have histologic or histopathologic presentations on the kidney. And to know the histopathologic presentation, you should know some terms. Is it clear? You need to know that what the contrary of diffuse is going to be focal, and the contrary of segmental, is it clear? The contrary of segmental is going to be global. Is it clear? Now, this is what we are going to see on histology. Now, diffuse means that it is more than 50% of all nephrons in the kidney that is affected. When we say that you have a diffuse glomerulonephritis, it means that it is more than 50% of all nephrons that are affected. But when you say focal glomerulonephritis, it is less than 50% of all nephrons of the kidney that is affected. Is it clear? Now, the next element is going to be segmental. Is it clear? When we say segmental, it means that it is less than 50% of only one nephron that is affected. Segmental means that it's less than 50% of only one nephron that is affected. While global, it means that it is more than 50% of one nephron that is affected, or a whole nephron is affected. Is it clear? So in case where you have diseases like diabetes mellitus, where you have a focal segmental glomerulonephritis, is it clear? So it means that in case of diabetes mellitus, generally the histopathology of diabetes mellitus is going to show what? It's going to show you a inflammation to more than 50% of it. Is going to show an inflammation to less than 50% of the nephrons of the kidney, and for which one nephron has less than 50% of it being damaged. Is it clear? So focal and segmental together. So those are the different terms that I wanted to bring out before we continue. So actually, these are the three major primary glomerular diseases. Is it clear? And now, when you understand the three major primary glomerular diseases, now I want to bring you now to know the syndromes now which are located, the glomerular syndromes. Is it clear?